All right. Well, I think we have just about everybody who's going to be with us tonight. Good evening. Good evening from Davidson, everyone. All of us here on campus hope that you and your families are safe and healthy and that you're making the most of this admittedly unusual and challenging summer. My name is Chris Alexander, and it is my great pleasure to serve as your moderator for this town hall session tonight. We're so glad that you're with us, and I want to take just a quick moment and extend a special word of welcome to the parents of new first-year students. Welcome to the Davidson family. We're thrilled to have you with us as part of this community, and we're so pleased that you have chosen to be with us tonight. I know that you are all anxious to learn more about the fall semester ahead, and you are very fortunate in that you get to spend the next several minutes with the team of people who, more than all the other people who've been working hard, but the people who really have been the architects of a plan for the fall semester that respects our values and our commitments to one another, but that also provides the very finest academic experience that we can provide. Now, this is a Zoom webinar. If you've never been in a Zoom webinar before, it differs a little bit from a more normal Zoom meeting. You, as you've noticed, you can't see each other, and the chat function doesn't function tonight. There's a good reason for that. We are going to operate entirely on the basis of questions that you sent in advance, and you sent great questions, comprehensive questions, lots of them. We are not going to be able to answer all of them tonight, but it is going to take all of our time together tonight to get through as many of the questions that you sent as possible. So we're not going to be able to take additional questions from you this evening. We are recording this event, so you'll be able to refer back to it. And as always, you can check the Davidson FAQ page, which will provide you with the most up-to-date information about Davidson's planning for the fall semester. Now, let me introduce you to the panel with whom you get to spend the next hour or so. First and foremost, we are thrilled that President Carol Quillen is with us tonight. We also have with us Dean Byron McCrae. Dean McCrae is Davidson's Dean of Students and the Vice President for Student Life. Dean Philip Jefferson is with us. Dean Jefferson is Dean of the Faculty and the Vice President for Academic Affairs. And I'm also very pleased to introduce to you tonight Dr. Robert Lutz. Dr. Lutz is a physician with Atrium Healthcare here in Charlotte. Atrium is one of Davidson's healthcare partners, and we are so fortunate to have Dr. Lutz as the chief architect of Davidson's COVID-19 planning and response strategy. Dr. Lutz comes to Davidson with 30 years of experience in the U.S. Army and a good deal of experience dealing with the treatment and the prevention, I should say, of infectious diseases. So your children, all of our families are in very good hands over the course of the fall semester. So with that, I want to surrender the floor for the next few moments to President Quillen.
Well, thank you, Chris, and I want to thank everyone out there for joining us. I'm sorry that I can't see you. We're excited that you're here, and we're excited that you're a part of the Davidson community. I just want to say a couple of words. I know you want to get to your questions about the ways in which we're thinking about the fall and how that reflects the kind of community that Davidson is and the community that we aspire to be. So obviously, this is a really unpredictable environment. Everything we do here, we're approaching in a spirit of humility. We cannot predict the future. We don't know what's going to happen, and we're not afraid to revisit decisions that we've made if that's in the best interest of this community. So our decision-making here reflects the environment. That said, our flexibility, our humility around decision-making doesn't change the values on which this community is based. So we honor those values as we go through the decision-making process. In particular, equity. We want to create an environment where all of our students are able to take advantage of the educational opportunities that Davidson creates. Safety and well-being of all of our community members, including our faculty and staff. And then a sense of collective responsibility, which really makes the Davidson community different. And I want to stress this for a second because it's important for you to hear this as well as for your students to hear this. Davidson is a place where in our community, we care about one another and we take a certain amount of responsibility for the well-being of people other than ourselves. And so the community relies every day, COVID, no COVID, on that spirit of community and on our collective sense of responsibility to something other than us and our individual choice. So our students learn from the time they get to Davidson how to balance freedom, and they have considerable freedom, with responsibility. And we're really building on that as we think about our COVID response with our students, right? So we want our students who have a bazillion questions about what they're allowed to do, not allowed to do, what it's going to be like, what it's not going to be like. We want our students to begin to think about their obligation as a member of a community where we care about one another. And we think, obviously we're going to be here and helping them, but we think that they can help us guide them to making good decisions. So instead of asking us 50 questions about, can I go here? Can I go there? Can I do this? Can I go that? We're going to ask our students, look, you know what the situation is. We've explained it to you. You have an obligation to the health of everybody around you. So let us help you go through a decision-making process through which you honor your responsibility to everyone here. That's how we want our students to think about it. We think that's an educational experience for them. And we do that whether or not COVID is here or not. Obviously, COVID dramatically raises the stakes of that. And we are going to insist on a kind of accepting of our community standards in order to protect other people's health. But I hope I've been clear about the spirit in which we're approaching this with our students as our partners as we try to create the safest possible community. I know you have a million questions about how exactly we're doing that. And I'm going to turn it over to Dr. Lutz, who can maybe run through a couple of preliminaries before we open it up back to Chris for additional questions. I just want to reiterate how grateful we are that you're here, how thrilled we are that you're part of the Davidson community, and how committed we are to the safety, well-being, and education of your students.
Thank you, Carol. Good evening. My name is Robert Lutz, and I've been here at Davidson College now for about 2 years. I spent 30 years in the Army, as was mentioned, and I'm emergency medicine trained. So what does that mean for me working with the college to help us go through this process? Well, as an Army medical officer from the time that I was very young, we really were inculcated in our training, and all the things that we did focused on preventive medicine, because disease and non-battle injury is the leading casualty causer in all wars combined, even when you have guns and bombs and rockets and missiles, etc. So over the course of my career and over 14 deployments, I put into execution preventive medicine plans to deal with diseases like malaria, diarrheal disease, Chagas, leishmaniasis, other things. And it's common across the board. The principles of preventive medicine are, identifying the threat, which in this case is COVID, understanding the vectors such as surfaces or respiratory droplet spread, and then putting into plans control measures that can help mitigate the spread of the disease, and then reassessing those and going back around on a continuous basis. So I'm also backed by the Atrium Health System, through which I have access to infectious disease physicians, and I've talked with them as we've gone along, as well as another Davidson graduate who's a pulmonologist who's here in the community, who's in my back pocket should we need any of his expertise for what's going on with our students. So I'll stop there and turn it back.
Thank you, Dr. Lutz. As you can imagine, when we talk with parents, we're talking with folks who care first and foremost about the health and safety and well-being of their young people. So I'd like to start with a few questions that give you a chance to talk a little bit more about how testing and other parts of our COVID-19 strategy will unfold over the course of the fall. As you know, and as many of the parents who are with us tonight know, the recent surge across the country in COVID-19 cases has prompted lots of businesses and schools to rethink the way in which they will approach testing in the months to come. And so recognizing that this is a fluid environment, tell us what you can today about what the testing process for Davidson students will involve, beginning with what students will need to do before they come to campus, what happens when they get here in terms of who gets tested, when, how often. Let's get through those basics, and then I'll ask some additional health-related questions.
Sure, thanks, Chris. So what we're looking at and putting into place is a plan to test all students prior to arrival through the use of a home testing kit that's mailed in or FedExed in. The goal there is to decrease the population of asymptomatic carriers as we come together as a group. I know that we will not remove or eliminate all asymptomatic carriers. It's just not an achievable goal. But by reducing the burden as we come together as a group and then implementing the control measures that we have of wearing a mask, social distancing, putting into place some of the virtual classes and such, we can slow the spread down for those who do bring it in and prevent it from running through our population unchecked. So once you're here, how does that look? One of the key things is to identify as early as possible those students that have symptomatic disease, because those we know are the ones that can spread it the most via the respiratory droplets. So students will have essentially what is a Symptom Checker application on their phone. It asks them just a series of questions. I think it's a total of 12 questions across 2 screens. And if any of the symptoms are endorsed, and there's high-risk symptoms such as high fever, shortness of breath, cough, that are really associated with COVID, and then there's lower risk associated symptoms such as nausea and vomiting or diarrhea, maybe a lower fever. If the student endorses any of those symptoms, they get a message to call student health to arrange for what we call either a virtual visit, which is a video visit, or just an interview by the health nurse to determine what the way ahead is. Does the student need a test? Is this a common thing for them? Is it the allergies that everybody gets when they come to North Carolina? Or is it the irritable bowel disease that a lot of students have to deal with? Or is it something more serious like a concern over COVID? And once we make that determination, that's when testing of the symptomatic patient starts, or symptomatic student. And we've got a couple different mechanisms. LabCorp can run tests that we do, but also we have access into the Atrium Health system through which we can get a test run for a symptomatic student. But in the process of identifying that this student needs to be tested, we're also going to start that process of isolating them into a room that's separate from other folks out of the dorm, where until we get a test result back, we can take care of them and make sure that if they are symptomatic with COVID, that it's kept from spreading to any of the other students. So that's the initial testing, and then the testing for symptomatic students.
All right. So if a student is asthmatic, if a student has a pre-existing health condition, it's not seasonal, it's not allergy, but it generates symptoms that are often associated with COVID-19. Is this student going to run a daily, weekly gauntlet of always having to get vetted to make it clear that the symptoms they're experiencing today and that they faithfully reported are in fact not COVID-19?
Great question. And that's truly the case. So as the students say, let's talk about diarrhea. I'm taking care of a lot of students, and they have a lot of issues with intestinal problems or irritable bowel disease, or et cetera. And yes, that's going to generate a yellow flag. It's an associated symptom, not a red symptom. So, and as part of that initial evaluation will be a discussion of what's normal for you. And if it falls into that normal range, the instructions I've been giving students, because I've been using this now for about 6 weeks as we've had some athletes come back on campus. And I have a discussion with them. I say, hey, is this normal for you? And if it's normal for you, don't necessarily endorse it every time or every day because you don't want to go through this process. But if your pattern changes, if something is different, you need to let us know soon, as soon as that happens, or as soon as you feel like that's happening, so that we can take the adequate measures to have a test run. And so for asthmatics who have shortness of breath, that's common for them, but is it getting worse? And most of the asthma kids I take care of understand when their disease process is changing. They're pretty sensitive to that.
Will students use this tool on their phones daily, weekly? How often is this a part of a student's life?
So the recommendation is daily, and it resets. I've got my screen right there, because I took it today. It says I'm green, and it resets every 24 hours. And through the process, I certainly don't want somebody to wait if they develop a symptom until their screen resets and they have to report it. They need to reach out early, and that's going to be part of the instructions that they get. But it's just a way of kind of reminding them to check every day. And there are places where we use it as entry points. For example, with the athletes that we're training with this summer, they have to show the green screen and get a temperature check before they're allowed to come on board and train.
Okay. What kind of protection?
Chris, can I just add, that is something that we're looking for everyone to use, our students, our staff, our faculty, all of us, because it represents a commitment on our part to think about our responsibility to monitor our health daily. And it doesn't take very long. It's a fairly quick and simple thing to do. And it is a part of being a member of the community at this time.
Okay. Dr. Lutz, I want to come back to you in a moment and ask a couple of additional health-related questions. But President Quillen, I'd like to ask you to elaborate a bit on your comments at the outset. It is very clear from what you said, from the information that has been communicated to students and families, from the information that is on our FAQ page, that our overall strategy for the fall is one that is very, very dependent on the commitments, the sense of felt obligation, reciprocal obligation that members of this community feel to each other. There are some students and some parents who look at that and express some skepticism about it. This is not an environment in which we can police everybody 24 hours a day, 7 days a week. This is not a place where we can give people a rule book with lots of rules that we can actually enforce. This really is dependent on buy-in and accountability and values commitments. So what kinds of things should families, not just students, but families know about how their young people can support the acceptance and compliance with these expectations and these values?
Okay, thanks, Chris. I'm going to approach that question from two directions. And first, let me just speak about the situation that we're all in right now. This is a virus that is contagious. We have no vaccine. And while we're learning more and more about it, we don't necessarily have foolproof treatments that address the symptoms and the damage that it causes. We all know someone who's susceptible to this disease. We all have friends who are older. We all know people who have pre-existing conditions. We all know people who struggle with chronic disease. And we are careful around them because we care about them. We're not going to subject our grandparents, our parents, our neighbors to a disease that we know poses a significantly greater threat to them than it does to us. And that is the spirit in which we're engaging our students. We all know people and we are careful. And so what we're asking of our students is to think about those people on our campus, off our campus, and to honor your commitment to care about their health. Right? That means something to our students. We've had really great success with the students that are around this summer, talking to them about this. They seem to understand it and buy into it. Now, I will also say that for people who simply refuse to buy into it, who with no apparent reason refuse to wear a mask, or who consistently don't acknowledge the importance of physical distancing, those students should not come to campus. it is not in their interest, and it's not in the interest of our community for those students to return to campus this fall. It's not I pass no judgment on them or anything like that, but I'm saying that's the way we're going to operate as a community, and people who consistently refuse to honor that shared commitment really can't be here because they pose a threat to others that matter to us. And I think all our students get that. I mean, we have an amazing group of young people that choose to come to Davidson. They built this community, right? They are responsible for the qualities in this community that we love and that attract faculty here. So I do have a high degree of faith in our students' ability to buy into this. Will it be perfect? We'll all make mistakes. And we need to remind each other of this set of obligations that we've agreed to. If I'm walking across campus or through a building with no mask, I want people to come up and say, hey, Carol, where is your mask? That is a really important part of this. And all of us are modeling that now on campus. The town of Davidson is a wear a mask town. You can't go into a store, you can't go into CVS, you can't go into a restaurant without a mask on. So we are modeling this behavior now. And I think our concern and love for the people who are more vulnerable to this than we are, our friends, other students, faculty, staff, that is a very powerful motivating factor.
People across the country are watching a range of institutional decisions about the fall semester. Various schools adopting various strategies, making different decisions. Davidson has chosen to bring all 4 years of its student body back to campus. Some other schools have decided, for reasons related to population density, to only have the first half of a 4-year progression or the last half on campus. Why did Davidson make the decision to bring all students back at the same time?
So I would answer that. I would say the question that we answered is a slightly different one than the way that you posed it, Chris. And I would say that because we care a lot about educational quality, we care about holistic education, and we care about equity, what we wanted to do was to offer all of our students the opportunity to return to campus and ensure that all of our students have extraordinary educational options should they choose not to be in residence in Davidson this fall. So and the reason why we didn't ourselves say, okay, only freshmen and seniors, is that there are a range of issues that each of our students face that mean that they might be better served by a more structured environment, they might be better served by being on campus, and we can't know all of those. And by creating a situation where all classes are one can take them remotely, we're offering classes in multiple modes thanks to our extraordinary faculty, we wanted to make the option of returning to campus available to all of our students because many of them face challenges or issues that we simply don't know about. And Davidson may be the best place for them to be for all kinds of reasons this fall. And so while we honor the choices that our students make. And so Dean McCrae has done an amazing job about working with individual students on specific housing questions and needs. We recognize that some students will choose not to come to campus, and that's fine, of course. We've created educational opportunities, curricular and co-curricular for them, no matter where they are. So I would say that we didn't prejudge that we knew what was best for each individual student, and we wanted to make that opportunity available to all of them. And working with Dr. Lutz and with our amazing facilities team, we believe that we can manage I'm not going to pretend there's no risk. I would be lying if I said there's no risk, but I think we think that we can manage that risk effectively, and that our students need the opportunity to make a decision that works best for them.
Dean McCrae, returning parents surely know that fall semester at Davidson is a time when many, many students, especially juniors, study abroad. And that's not going to happen next year, or at least not nearly on the scale that normally is the case. And so a number of parents have expressed concern about whether or not we can handle them all, and can we do it safely? So what is our strategy for managing on-campus residence life, particularly housing, in a year when we might have more students on campus than ever before?
Right, and so we've relaxed our residency requirement for precisely that reason. And so students who want to be in Davidson certainly have permission to live off campus, and they should notify the Residence Life office by emailing Dean Walter Snipes about that decision. Right now, we're actually not at capacity on campus. That's not an invitation for people to come. But if a student is willing to abide by our guidelines, and they're committed to limiting the number of students that visit them, they understand that there are no overnight guests, and they understand that there aren't parties. And there's no way to wrap that. It would be kind of reckless and irresponsible to allow that to happen. If they understand that, and the upside is they can still co-create community with peers, and they can be on campus. I know that there's at least one student living in his parents' living room right now, and would much rather be on campus. If they're willing to do that, we believe that we have room for them on campus. Currently, there are 50 beds that are vacant, and we will likely use those for isolation and quarantine housing. Does that answer your question, Chris?
Yes, thank you. Thank you. Dean Jefferson, after health and safety, and after making sure there's a roof over people's heads, I think academic life is the thing that is of greatest concern and interest to most parents. And parents went through, whether they had a high school senior last spring or they had a Davidson College student, they went through a spring semester that was more rugged than any of them would like. And so many parents are interested to know what kinds of things has Davidson's faculty done to make the fall learning experience better? Are they modifying expectations? Will the workload change? Will there be different tools and platforms than Zoom? How can students and their parents look forward to an academic experience with mixed formats that is better than their spring semester experience?
Thank you for that question, Chris. First, I'd like to say that we all learned a lot. Last spring, we did a very sudden pivot, and it was a real opportunity for us to see what worked and what did not work, particularly with respect to pedagogy. And Davidson, relative to some other institutions, was very fortunate because we have in place a Center for Teaching and Learning. We have a tremendous library staff that has a high level of digital capability. So what we did at the end of the spring was come together and plan something called a Digital Learning Institute that is running this summer over the course of 4 weeks for our faculty. And what we're doing in that Digital Learning Institute is developing modes of instruction that are quite varied, that are designed to match the pedagogical objectives of the faculty with respect to the material that they're teaching. So each faculty member is learning at least 3 different modes of instruction. They will have presentations that will be offered synchronously and asynchronously. And so there'll be a great deal of flexibility that will permit academic continuity. Now, with respect to the semester itself that's coming up, it's going to be 13 weeks long. Typical Davidson semester is 15 weeks. So what our faculty have had to do this summer is really reimagine their courses and redesign those courses so that each and every student is able to maximize his or her learning potential without feeling as though 15 weeks of material has been squeezed into 13 weeks. And so while some might view this as taxing. Rather, I like to think about it as an opportunity to reimagine individual courses and the curriculum as a whole. And I think students who return are going to find new opportunities, new ways of learning, a variety across the different courses, and like cross-training, that is going to exercise the mental muscle in a way that may not have been exercised before. And so I think it's going to be a quite exciting and dynamic intellectual environment here at the college.
Wonderful. Dr. Lutz, I'd like to come back to some health-related questions. We talked a little bit about how we would detect in advance students who become ill. Let's talk for a minute about what happens when we identify a student who's sick. So if a student tests positive, from that point on, what happens to that student? What happens to that student's roommate? What does quarantining look like? Do we have sufficient bed space available to quarantine or isolate students on campus? And what will the protocol look like both for the student who's ill and her roommate?
Thanks, Chris. Yeah, so the way it's going to work is let's follow the path. So we have an individual who's symptomatic. They identify it on their through their questionnaire, or they realize that because they've done the questionnaire a bunch, they've now got a symptom. They call student health. They're instructed to start to isolate, self-isolate, stop going to get meals, stay in their room until they can get evaluated. They set up an evaluation through a virtual visit. We have a 2-room building just between Belk and the Commons that we'll use for these virtual visits, where they come at their appointed time. They get vital signs taken to include a temperature, pulse oximetry, pulse, blood pressure, get a little bit more in-depth screening of their symptoms, and then they're scheduled then to have a virtual visit with one of our licensed healthcare providers through Student Health or through myself. And then we have a decision to make. And so one of those decisions, as I talked about, is this just a manifestation of regular symptoms that the student normally has? Or is this a concern that this is a COVID-like, or oftentimes a term we use is influenza-like illness that needs to be tested? If that's the case, we coordinate through moving that student into an isolation room while a test is pending. Get the test ordered, get the test done, they wait, the results come back. The results are negative, they go back into the population, get reevaluated to see if there's something else we need to treat, if it's strep pharyngitis or another cause. If it's positive, they stay in isolation and they get enrolled in what we call the virtual hospital, which is not a brick and mortar hospital, but it's a construct that Atrium Health has been using since late March. I think the last week of March, early April was when this started. And they're very experienced, so people stay home. They get regular check-ins by a nursing team that, through the use of standard questionnaires and standard assessments, can check in and see how the patient is doing. And if things get worse, they can elevate the level of care up to direct admission to the hospital, bypassing the emergency room or any other places like that. And so the team that's been doing this has been doing it now almost 3.5 months. And it's worked very well. It's kept a lot of people out of the hospital in a safe manner, and has unloaded a lot of the Charlotte hospitals, preserving the beds for more seriously though. For the student's roommate, because they no longer have a roommate, they will begin sort of quarantine procedures within their space. And one of the things that we want our students to do is essentially treat everyone like they're infected. And so that's why the masks and the hand hygiene and social distancing. So having them isolate even a little bit more is just that added barrier to stuff that they should have already been doing along the way. And we'll support them through that. If they develop symptoms, we'll swoop them up and get them tested, take care of them as needed. Address most of the issues of your questions there, Chris?
Sure. So if a student were to become ill enough that he or she needed to go to the hospital, does Davidson have a method for transporting that student?
So the answer I would say is it depends. And so there's ill enough that you need an ambulance, then you go by ambulance. If you're ill enough that you need to go to the hospital to be admitted, there would be different options. I've been working with with the physical plant to have one of our vans outfitted with a plexiglass sheet between the driver compartment and the rear, so that we could take a student physically distanced, separated from the driver, to the hospital if needed. The whole goal of this program with the virtual hospital is to identify those patients that are getting ill and getting them to the hospital before we need to call an ambulance. We have to call an ambulance, we've missed the boat. But by checking their symptoms, by checking their oxygen levels, they all will have a pulse oximeter in there with them. They will have a thermometer, and we'll be tracking that. They have a number to call. So if they've been called and they were fine, and then 3 hours later they start feeling bad, they've got sort of a one-stop shop to call for help. And I'll be the attending for the students that are admitted to the virtual hospital. And my backup is I've got a pulmonologist, a critical care doctor who is a Davidson grad who just lives really down the street from me, and he's volunteered to help out. He's been taking care of a lot of COVID patients, and so I think we've got that team approach to get them to the hospital in an orderly fashion before anything turns sideways.
If I could chime in too, I mean, it's certainly, if families, if you're within driving distance and you want to come get your son or daughter, I mean, that's certainly a possibility. And so in the spring semester, a student stayed in isolation housing until a parent could come get them. And so we're not trying to say it's a burden or that we're not trying to have them be here. If it gives you peace of mind, we were able to provide gloves and masks to families that didn't have them upon arrival. And so we are certainly willing to coordinate with you the best possible solution that would work for you and your family. If you're from the West Coast or you're international and that doesn't work for you, we're trying to illustrate a plan by which the student ideally has a seamless experience. And so they can be in isolation or quarantine and continue classes if they're up for it. So hopefully that gives you a sense of the nuance with which we're trying to approach this.
McCrae, one of the things that families value most about a residential liberal arts college like Davidson is the powerful development and educational opportunities that take place outside the classroom. We know that campus life this fall is going to be very different. Can you help us visualize what daily life on campus will be like? So for example, students have been told that their CAT cards will only admit them to their residence halls. They're used to going to the next building to see a friend or to use a computer printer. Will they be able to do that as they move through their day? If they realize that more than a certain number of their friends happen to have congregated, what kind of rules about just impromptu group interaction do they need to keep in mind? What will Patterson Court life look like?
Yeah, and so we really do need to reimagine those opportunities for the better. We will follow the state guidance. Our ability to follow state and county guidance, our ability to do this hinges on our ability to follow that guidance. And so over the summer, every time a group of students was walking on the sidewalk and it didn't look like they were appropriately physically distant, a community member actually would email us. And so I share that in the spirit of, I don't know that we don't want to turn the institution into a hammer looking for a bunch of nails. We want to work in partnership with students on creating the kind of environment that they want. And we want to accept the challenges and face the challenges that this global pandemic presents to us in our communities together. And so we want to be working with students on that. But to answer your question about what student life looks like, we really want to amplify student ideas. We are working on some ideas about how to be physically distant but socially connected. And so does that look like yoga mats 6 feet apart, on the lawn? Is that something that students would be interested in? What ideas do they have, and how can we support those ideas? I think the students are thinking, why are you asking us? You should have some of that. But we want it to be something that they are brought into. There are some clear limits, like there won't be parties on Patterson Court. But those organizations have really rich traditions of philanthropy and taking care of one another. So we do want to sustain those ideas. And so I've issued friendly challenges to the SGA, to student athletes. How can they call their peers in and build a thriving social life in these trying circumstances, knowing that the institution has their back in doing that?
Yeah, Chris, could I just follow up on that briefly? Sure. I think I've talked to a lot of student leaders who are returning to campus, and there are student groups that know already they're not going to be able to do whatever it is they originally came together to do. And they're performing arts groups, or they're groups that work extensively in the community. And they are already thinking about, how do we honor the purpose that brought us together in this environment? And I think that's actually the challenge, right? You came together for some purpose. What does it mean to honor that purpose in this environment? It's not what you used to do, and it's not forever, but this is how we honor this purpose right now. And in the same spirit, the Center for Civic Engagement, the Union Board, the Center for Career Development, all of these entities are looking for ways to create programming that honors their intent and their commitments and their purpose in this COVID-19 environment. And we are, as Dean McCrae said, we're calling on our students' creativity and incredible intelligence to help us figure out with them how we can support their great ideas. Davidson is a place that relies on student ideas all the time. Every class of Davidson students makes this place better. And so we're inviting them to help us do that now in this environment.
Fabulous. Dean McCrae, I want to ask a couple of questions about the interaction between Davidson students on campus and the world beyond. We are discouraging students from leaving campus overnight, and we're asking students to be very mindful of any time they leave the campus and go into the community. These are not prohibitions. We're neither inclined nor able to enforce those kinds of prohibitions. But as parents think about talking with their young people, about how they make decisions, about going to the grocery store, going to CVS, to the pharmacy, what kind of ideas, thoughts, suggestions would you share?
Yeah, and so I appreciate that very much. I'll share a personal anecdote. Many of you know that I moved to North Carolina to be closer to my family, particularly my one remaining grandparent who just turned 93. It would have been irresponsible for me to have gone to my grandmother's birthday party and then caught COVID. And so we don't take these decisions lightly or uncaringly. And so we've received a number of these questions, Chris, and we are in many ways discouraging students from trips that we know are important to them. Certainly if a student needs to refill their allergy medication, they can absolutely go to CVS, where they will be required to wear a mask. I go to the grocery store where I wear a mask, and everyone in the grocery store really does abide by physical distancing. I'm aware from talking to students that there are some states that students haven't been able to eat in a restaurant since February. So we're a little different there, and I think our governor in particular is very cautious. And so to answer your question, we will continue to promote and circulate the health guidance of local officials. We will look to health educators on campus, the hall counselors and RAs, to communicate with students about expectations. And again, not necessarily always from an enforcement perspective, but from a we all need to do this together perspective. I will also say, as the Dean of Students, I have to say this, if there are students that are just flagrantly not willing to get with the program, so to speak, we'll have to talk to them about whether they can return here. If students try to throw big raging parties on Patterson Court, I might need to ask parents to come get their students or make arrangements for them to live off campus. I don't say that cavalierly. but it's the truth. And so I hope parents can hear the spirit behind that.
Sure, sure. Flip the coin for a moment. We know that Wildcat Weekend, which we traditionally have called Family Weekend for you first-year parents, a weekend in October generally when families come and dip into the life of the college and their young people's lives. That's not going to happen on campus this fall. Beyond that weekend, will families be discouraged from allowed to come and visit their young people at any point before Thanksgiving?
I wish I could see the families' faces so I had a better sense for how to answer this question. It's really tricky. No one wants to live with the regret of maybe taking this back to their family or community. Some of my staff sat with truly anguished students who are thinking about when and how they went home at the end of the semester. And so some students had to quarantine before they actually saw their family. So they had to stay with a neighbor before they were actually able to go home. It's really difficult to imagine seeing the national landscape that is possible for families to come visit. And so I encourage stockpiling yeast and making cookies. And again, I'm not trying to be flippant or glib, but letting your son or daughter know that you're thinking about them, committing to a regular FaceTime appointment, and then giving us feedback about what the students might need. We recommend those strategies other than campus visits.
Okay. Dean Jefferson, returning students, they know how to navigate academic life at Davidson. They've developed strategies. They know how that rolls. That's less true for incoming students. This is an opportunity to share some wisdom with both of those groups, both new students who don't necessarily have preconceived strategies for how you navigate academic life, and people who think they've got this down pretty well. Well, this is going to be a different kind of semester. So is there any particular advice that you would share with families? Is there some way in which this fall semester will differ, that will require students, beyond just being flexible, but to prepare in some different way, to think about their work in some different way? If a student is accustomed to approaching their academic work in a particular way, is it conceivable to you that there's something about this semester that will mean that they need to change?
One thing that's going to be very important for students, first-year students, and returning students is to connect with their advisors, okay? We have a robust, holistic advising program, and it's going to be important that students connect with those advisors so that they can receive the kind of guidance that will help them to make the choices consistent with their academic goals. There's going to be new courses, believe it or not, new ways of learning. And so what I think most students will want to do is sit down with their advisors early in their arrival here at the college and say, wow, the landscape has changed. So let me give you an example. In recognition of this extraordinary period, the faculty has passed a change in the minimum course load required to be considered a full-time student. In that for the fall semester and the spring semester, 3 courses will count as the minimum full load. Students can still take 4 or 5 courses, but that's going to be the minimum. Well, that's different from what was here in the past. So students will need to think about their academic goals and their programs, match up with their holistic advisor or major advisor, and decide, how does this new flexibility work for me? So if I could give parents one word of advice in terms of communicating with their student, and that would be to say, I encourage you to meet with your advisor earlier in the year. You're going to find expanded opportunities, even in this situation at Davidson. And so you're going to have space to be more creative and there may be particular passions that you're going to be able to engage that, believe it or not, you could not engage earlier before the pandemic. So please meet with your advisors, see what the opportunities are, and go from there.
So, Dean Jefferson, one of the things that makes us really lucky here at Davidson is that we live in a place that has very clement weather for most of the year. Several parents have asked if Davidson classes, some of them, will take place outside. Have we expanded our outdoor classroom capacity?
So the way that we're handling that is that we're going to have some spaces outside that are going to be very robust with respect to the opportunity to take a class outside, not within a particular class period. So we're not scheduling any given class to be entirely outdoors, okay? And there are a number of reasons for that in terms of accessibility we have to be very concerned about. But what we're doing is providing those spaces. So if on an individual class basis, a professor wants to take the class outside, then that's going to be available to that professor.
Fabulous. We are coming close to the end of our time together. I have a couple of final questions that I know are very much on families' minds. Dean McCrae, one of these questions is for you. As families think about the month ahead, is there a date certain by which they need to notify Davidson about their young person's decision? And then, relatedly, can that young person change his or her mind after they get to campus?
Yes, and so after they get to campus, if they're concerned, if they're homesick, if they have any reason that they don't want to continue, they can let us know within the first 10 days, and then we're not going to keep them here. We want families to have the freedom and support from us to feel confident in their decisions about the fall. And so we don't want to rush that. If you have an instinct about whether you're not going to be here, letting us know that sooner than later is helpful in terms of making isolation plans, quarantine plans, our partnerships with local health providers. But we also don't want to rush you either. If you feel like you need additional information, please encourage your son or daughter to call the Dean of Students office or call the area that's appropriate, Student Health and Wellbeing or Residence Life, and ask really direct questions. Okay. Is that useful?
It was, thank you. I want to give President Quillen the last word. Before I do, though, several parents are mindful of the fact that this fall semester coincides with an important electoral season. And some parents have asked if the campus or student organizations are able to help students register to vote.
Yes.
Okay.
They're working on it.
Yes. We have a whole series of plans, not only to help our students register to vote, but to help everybody register to vote. It's the passion of a number of our student organizations. I have a meeting with some of those students next week. So I think there will be a number of register the voter efforts.
Great. President Quillen, I want to leave the last word with you as we close out this evening. Any final wisdom that you would like to share with families about what will happen at this campus in the fall semester, why it is really going to be a fabulous, though different experience for their young people?
I mean, I guess what I would say, as a parent to parents, this is not a situation that anyone wanted. I wouldn't wish the situation on anyone. It's a situation none of us expected. And at the same time, our students are incredibly creative and smart, and they will bring to us ideas about how we can live out our values under these circumstances. And as Dean Jefferson suggested, our faculty are already creating educational opportunities that did not exist pre-pandemic because they're motivated to rethink how they approach certain kinds of material. They're motivated to teach courses on subjects they have never taught courses on before, or to shift the direction of some of their classes. Our student organizations similarly are focused on how they can live out their purpose in this environment. And so I don't want to pretend like this is like that this is, you know, what anybody wanted, but it does offer opportunities for your students to learn and engage and build community in new ways. And if we all come together in the fall, bring in our creativity and our imagination, I think that we will learn a lot about what it means to lead and serve our community.
President Quillen, thank you. Dean Jefferson, Dean McCrae, Dr. Lutz, thank you so much for your time, for your wisdom tonight. To you parents, thank you. Thank you for entrusting us with the education of your young people. Thank you for the fabulous questions that you've sent in. As I said at the outset, I know we weren't able to answer all of them. Please reach out to us. Let us help in any way that we can in the days and weeks to come. We look forward to seeing you and your young people here soon. We wish you the very, very best for the rest of this summer and for the fall semester that lies ahead. Be well, and we will see you soon. Thank you, and good evening from Davidson.